Wow, we are live. Welcome, everybody. I'm Dr. Jerry Cartsidell, a board certified pediatrician, and we're going to study the occult today. Not the occult you might be used to. In medicine, we call things that are hidden viruses, hidden infections, occult. Okay, they're not readily apparent, like, say, a skin infection on your arm. So we're going to be talking about infections, and we're going to be talking about what drives our kids absolutely crazy. And this has been brought to you by a patient I take care of, Sarah, who has an occult infection, a urinary tract infection. Okay, so where can infections hide, and what do the infections do? First of all, there always seems to be a change in the behaviors. Obsessive compulsive behaviors, brought to you by my son Josh, and a skin infection. There can be self-injurious behaviors. There can be screaming, crying, tantrums. There can be vomiting. There can be increased urinary frequency. There can be a lot of issues with the infections. Last week we spoke about teeth and the infections in the tooth, whether it be a dental carie or a abscess in the gum or an abscess in the cheek. And now we're talking about other infections too. So we always have to look when there's a sudden change in your child's most pleasant disposition. Where can the infections can be? Well, let's look at, say, my son Josh. He had looked like a bug bite on his right thigh, and I was watching it heal. There were 3 or 4 of them, and then it was down to one, and it was taking its time to heal. And my wife noted that there was increased obsessive compulsive behaviors. So she said, "Don't you think you ought to treat that with an antibiotic?" And I'm going, "No, I'm not going to treat a little bug bite with an antibiotic." A couple more days go by, not quite healing. His obsessive compulsive behaviors are getting big. "Don't you think you ought to treat that with an antibiotic?" Yeah. So I put him on azithromycin, and all of a sudden the bug bite starts healing up miraculously. And at last count, his obsessive behaviors have de escalated instead of escalated. So that was one area. Another young lady, and this is actually be a little more common, the urinary tract infection. They don't usually present the ways most people do with UTIs, where it hurts, they have fever, blood, but they have a UTI. And so very often when I have a child who's having more seizure activity, self-injurious behaviors, decreased appetite, vomiting, then I'm going to think, well, we need to check the urine. It used to be you had to get an order for a urinalysis and go to the laboratory. They make you pee there, some kind of liability, whatever. But anyway, you can get urine dipsticks at Amazon.com. You can dip the urine. The Azo stick looks at nitrates and leukocytes. That's all you really need. If you want to look at other things, then you can buy a 12 or 14 panel thing, but there's a lot of stuff there that you wouldn't know maybe what's on there. But that would help me out too, is if I see nitrites and leukocytes in the urine, then I know that we have a UTI. I don't necessarily have to go get it cultured, but we can start an antibiotic sooner as opposed to later. So urine is another source, skin is a source, the mouth is a source. Other areas can be sinus infections that we can blow off as being allergies, snotty, 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 and we think, well, it's fall, it's spring, these are his allergies, until we see the yellow or green mucus. And by the way, the behaviors are through the roof. So they always have behaviors, and that's kind of a key point for me. They have behaviors, and we have to try and figure out where they're coming from. So I'm going to think of the infection. And then you get into the viral infections, like the herpes group, and that's Epstein-Barr virus, cytomegalovirus. You can have herpes 6 virus. They can be a problem, and we have to do laboratory testing to see if that's the issue or not. Then the other ones would be Lyme's. And again, there's a lot of positivity with Lyme's disease. And then we have the mold exposures, which we were going to talk solely on today, but I think I wanted to talk about all of these together so you can build a picture of what's going on with that. So I'd say that when we have a child who's having behaviors that have escalated lately, obviously you're thinking, was there a dietary infraction? Is there constipation? The obvious things, but then you have to start thinking about infections too. So anyway, what do I do to treat that? I would basically say the first thing we want to do is try to figure out the source of the infection. If it's readily seen, like on the skin, in the mouth, the gums, the teeth, or checked by the urine, that's a good place. We may have to get laboratory work. That's also a good place for things to help us figure out where that particular issue is. Oh, he's just working that. Nobody's following right now?
Well, they're watching, just no question.
Oh,
Hi, everyone. I'm the voice behind the screen.
That's David.
Hello.
He's pulling the little thing for me.
So they're watching.
But nobody's talking to me yet.
No one's talking.
Good.
They're listening. It's good.
Listening is great. See, I learned something new. Hi, everybody. So, antibiotics. Don't like to use antibiotics. You can see how much resistance I had even putting my own son on azithromycin. But sometimes you just have to. And what we're dealing with here is not so much the infection going in the brain. It's an autoimmune response to the infection, and that's what drives up the OCD. And then we get into that area called PANDAS or PANS. And again, I don't want to have to put these kids on antibiotics. So for urinary tract infections, what do? Once they're infected, I will treat them with an antibiotic because the kids can't really communicate if they're clearing, if they're feeling better or whatever. And I don't want it to spread up the ureters and get into the kidneys. So I will put them on antibiotic. If it's a once and done thing, then I don't need to do anything else. If I have somebody who has a tendency for recurrent urinary tract infections, I'll put them on D-mannose, MANNOSE, and maybe with the cranberry extract, okay? And that keeps the bacteria from able to bind anywhere in the bladder, so it has to flow out. And of course, we always want them to drink more fluids. They're not going to drink things like parsley juice and garlic and all that kind of stuff that you see that neurotypical adults might be able to do. But we can certainly get them to take mannose and cranberry. If they have recurrent infections elsewhere, whether it be sinus infections, ear infections, or throat infections, then we'll take care of the infection abruptly. But what if the tonsils are huge, and I had one this week, huge tonsils, and they're cryptic and they got pus inside of them? It's kind of like a giant abscess that just sits in the mouth. You put them on antibiotic, they get a little better, then a week after the antibiotic they get worse. Sometimes, and I hate this too, but the tonsils have to be removed. In fact, I had a child earlier this week who had such large tonsils that they were blocking the airway during sleep, and I suspect that's where all that attention deficit's coming from, that they get low oxygen levels during sleep, which we call sleep apnea or hypoxia, and they tend to have a lot of attention deficit issues. That also could happen with seizures at nighttime while they're sleeping. If they're seizing while they sleep, you would never know it, and they have ADD. So you always want to make sure that we don't have anything that's occluding the airway, and they don't have epilepsy when looking at attention deficit disorder. The teeth, as we talked about, they got to see the dentist, and most of the kids have to be put to sleep, sedated, and the restorations have to take place, and the abscesses have to be drained, and that's a big to-do. But it's very important because I have one patient who's still waiting, and Joseph, and you know who you are, to see the dentist because during COVID-19 they're not taking him back to the OR, and mom's telling me he's got this behavior and that behavior, and he's aggressive and he's mean. It's like, I got nothing. Until you get the teeth under control, the abscess is drained. I can't fix that because it hurts. You can imagine, it hurts. Every day it hurts. I'm surprised that these kids don't pull their teeth out. I've had two children who actually pulled their teeth out because they hurt so bad. They don't. They do some interesting things sometimes. I go, really? He pulled his tooth out? Okay. So our dentists are a little bit recalcitrant to helping our kids with special needs, getting them in soon, taking them first case because they have to be without food. They have to be almost dying for them to get emergency care in a lot of areas in the country. All right, so the teeth we got. The viral group, that's an interesting group. I have to look at that with laboratory evaluations, laboratory exams to see which of the herpes virus it is, or if it's Lyme's disease that we're dealing with. And then we can spend a whole show just talking about viral infections. All right, so people are writing. Let's see if they're writing to me or just talking to each other, because they can do both, right? Angie joined. Hi, Angie. And I'm sure we got that antibiotic for that UTI. That's good. My wife, Donna, is watching. Hi, love. See you soon. And then we've got Ryan. Hey, Ryan. Let's see here. I'm 33, abdominal very badly, went to get off of them. I've been on them since 2007. Haven't had any luck with doctors. They've all made it seem impossible and not right to get off of them. Oh, I think I'm reading it backwards here. Okay, let's go and see what you're talking about. And Gina's here too from West Tennessee. Hi, Gina. Okay, Ryan says, can you please talk about the future, how those with autism, those young and those who are adults, can get off of antidepressants, mood stabilizers? It can be done, can't be done cold turkey, you're absolutely right, and something very bad can happen. Really, you have to go slow and you have to make a plan. But everyone makes it seem impossible, and like getting off of them isn't possible and the right thing. Also, what to replace them with, such as dieting, essential oils, etc. 2033, and you want very badly to get off of them, been on them 2007, and you haven't had any luck with doctors. Well, very, very good question, Ryan. With those kind of medications and your issues with depression and or anxiety, and maybe there might be some obsessive compulsive behaviors, you really do have to work with a doctor. You'll have better luck working with a functional medicine doctor. Functional medicine doctor. The functional medicine doctor can look at different alternatives to help control the anxiety, the OCD, the depression, natural supplements that work. So what I tend to do when I work with these folks is, say you come to me with these medications, and they're working, okay, I will bring in these natural supplements, and it might be medical cannabis, it might be SAMI, it might be ashwagandha, it might be antibiotics because you have a chronic infection. But I bring in natural things as best I can. And you know, doc, I'm feeling pretty good. And I'll say, okay, let's look at the three, because very often they come in with 3 different psych drugs. Let's work on getting rid of one first. Okay? And then we lower that, and see how you do. Now we're down to 2. We lower it. Oh, we can't go any lower. I'm not feeling good. Then we stay there for about 2 or 3 months. Risperdal, Abilify, whatever. Then we can start lowering it again. The key is that you've been on them so long that it may take a year to remove these medications. And if you're on benzodiazepines, it could even take longer. But the good news is you don't finish weaning from them unless you start. It may take a while, but a year will pass, a year and a half will pass, and very often. But the first thing is you want to capture the behaviors a different way with different natural supplements. And then once you've done that, then you can start weaning this group. So bring up this group first, and then start weaning this group. And I've had kids where Say it's a 20 milligram tablet of something, and the next size is 15 milligrams. I can't go from 20 to 15. That's too much of a wean. So I actually have to have a compounding pharmacy, because they can do anything. They can take that 20 milligram and turn it into 19. And then I could sit at 19 for a month, and then I can say, give me 18. And I could sit there for a month and give me 17. So I can go down 1 milligram at a time, or whatever the case may be. Some people are on Zoloft 100 milligrams a day. They may tolerate me going down to 90. They may not. Okay. So anyway, it can be done, but the first thing you want to do is capture the behaviors with an alternative set, and generally your functional medicine doctors will be able to help you with that and get you off those psych meds. All right, so that was a good question from Ryan. And because I'm down in Orlando, no, I don't know the Pennsylvania area, or I mean, I don't know the doctors in every different area and in all the different parts of the country. So you probably would either, if you have a group of people you hang with, you might know who's hot and who's not. But you definitely don't want to go to a traditional psychiatrist. You don't want to go to a regular, you know, family practice doctor or internal medicine doctor. They don't know. It's not that they're stupid. They just don't know. It's not their thing. Functional medicine doctors really take pride. Oh, if you go to a4m.org, I think it is, the letter A, the number 4, and m.org, and you can put there's a doctor search there. The A4M doctors, you can call their office and see if they can help with the psych meds. It can be kind of complicated, so you really you can't do this on your own at this point. You can't do it on your own. So good, I hope you find the right doctor that works with you, and see if we can get things really turned around for your life. Pretty exciting. Can be a little bit frustrating because it takes so much time, but you make the right direction. It's like trying to get out of credit card debt. You have to go after the smallest problem first, get rid of that credit card, and go to the next one. And if you start planning now, in 5 years, you can be debt-free, at least with credit cards. So that's the approach you take. All right, good question. Yeah, I figured that you're on the autism spectrum. And again, people always get concerned about when I start treating autism. It's like, why are you treating my autism? I'm not treating your autism. I'm treating the anxiety or the constipation or the diet or whatever is keeping your mind from being all that it can be. Just like I would do with anyone. If you came in with a broken arm, I'm going to have it set. If you come in with a urinary tract infection, I'm going to have it fixed, because what we're trying to do is optimize your body's health. And as you're already picking up, your body's health may not be optimized with these psych drugs. On the other hand, they are stabilizing something, because you're still here with us, so that's a good thing. All right, Ryan, I hope you find the right doctor real soon. Okay, let's see what else we got. Gina asks, how do you determine if you're a strep carrier? How do you treat strep carriers? Oh, great question. That's actually general medicine, and docs should know how to do that. You do a throat swab when you're well. And your throat swab should be negative. And if it's positive, then you are a carrier. In other words, you're asymptomatic, it's not bothering you, you're just fine, but it's positive, and your positive throat, that carrier state, you can give it to somebody else, and they'll get the disease. Okay, so there is ways to treat that. You can use certain antibiotics like rifampin that destroys the carrier state, and then you take that course. And a general doctor would know how to do that, or could easily look it up, what they feel comfortable with. And then the big thing that you have to do after you get treated is about a month later, go in there and get swabbed again, just to show that it has been removed. So by definition, the carrier is asymptomatic. They don't get the disease. They don't get strep. It's interesting. Meningitis is a deadly disease, and in Saudi Arabia, when Pakistani men come to do their Mecca, they're known carriers of the meningitis in their throat. Doesn't bother them, it's not deadly to them, but other people around them are susceptible and can get meningitis and die. So we can be carriers and be not susceptible to the disease. That's very interesting. Oh, right. What else we got? A rapid strep test. And I like the culture. I like the culture. Um, if the rapid strep test is negative, it's probably negative, but if the culture is negative, it is negative. So if we're really concerned because strep keeps running around the family, then I like to get that culture done. All right. Adrian says hello. Adarian. I'm sorry, Adarian. My eyes. Adarian. Hi, Adarian. All right. Let's see. Anything else? Nope. That is it. Okay. So last call for questions, and then if not, I'll wrap it up. And next week we'll be talking about mold, because I want to give a whole half hour on mold. A moldy oldie. We're going to talk about what does mold look like, how does mold get into your body, what does your body do with mold, why is it a problem, and then how do you treat mold. Okay, and there's a lot to it. It's kind of controversial. Well, everything in medicine these days, well, medicine, everything is controversial these days, right? Mask, no mask, whatever. I remember when the major controversy was vaxxer and anti-vaxxer. Now that's fallen by the wayside. There's mask and anti-masker or whatever it is out there. So everything is controversial these days. But how to treat mold, there's different ways to treat mold, different approaches to treat mold. We'll talk about some of them and the pluses and the minuses, how to detect if you have or your child has mold issues. My son had major mold issues. When we'd walk into a main, a store like J.C. Penney, and you can kind of smell the mold when you walk in. You had about 10 minutes with my son before he started falling apart. So we'll talk all about mold. The whole show will be on mold next week. All right. Last call. Let's see. Any more questions? Looking. That's it, guys. So have a great week. Keep your sanity. I know easier said than done, especially with all my homeschoolers. I mean, long distance learners, because we don't want to confuse the two, right? We're against homeschooling, but we love long distance schoolers. I'm talking to a lot of parents this week who have children home, and they're teaching, and it's exhausting. It's exhausting. They're exhausted. So hopefully all of this will end really soon in the next month or two, and we'll get back to a nearer normal than where we're at. All right, guys. Hey, God bless. We'll talk to you next week. I look forward to it. Take care. Bye-bye.